Hi, welcome to Motivate Therapy's What to Expect Pelvic Floor Therapy for Male Pelvic Health. Knowledge is power. This is where you learn what pelvic floor therapy is and how it can help you change your life today. We provide a safe space to talk about anything and everything that has to do with your pelvic health. Symptoms that we don't like to talk about or understand, such as urinary incontinence, difficulty initiating a urine stream, pain with peeing, bowel issues such as constipation or fecal incontinence, sexual dysfunction such as difficulty getting or maintaining an erection, pelvic pain such as penile, testicular, or rectal pain, or even back and hip pain can play a role. Post-surgical issues such as pain, sexual dysfunction, or leakage. Statistics show that 80% of men should be wearing 0 to 1 pads after 3 months, and after a year, 98% of men should not be wearing a pad at all. So don't be a statistic. Motivate Therapy is a group of like-minded people dedicated to helping you achieve your goals and change your life. We are occupational therapists and physical therapists, and our philosophy is that you cannot change anything that you're not aware of, and so motivation and education are the key. Therefore, anybody can change their life no matter their age or stage. Hi, my name is Denise Nichols, and I am the owner, director, and occupational therapist at Motivate. I've written a book called Your Self-Care Matrix, which just highlights the steps that you can take to change your life today. We don't want to think or talk about anything going on down below. But if you can understand today that your pelvic floor is part of your deep core, and so truly what pelvic floor therapy is core re-education. So thinking about it and talking about it is how we change it. So because your pelvic floor is part of your deep core, it highly benefits from a neuromuscular rehabilitation approach, a natural conservative approach, just like you would go to therapy for your neck or your back or your wrist. And therefore, it is a covered benefit from your insurance as long as you have a referral from a medical provider. And really all positive change requires is your dedication and commitment to change. We have changed so many lives. We have scores of testimonials like this where people change their own lives by raising their hand, talking to their medical providers, maybe doing research about pelvic floor therapy. However you found us, now that you've raised your hand and because your symptoms have affected your quality of life, know that you have found your tribe. We can help change your life just like we did with this gentleman. I believe that every person on their health and wellness journey has the right to expect to be heard, to expect results, and to expect continued resources and support. And that is what we provide at Motivate. That is what you can expect when you come to therapy for any condition. By the time people find pelvic floor therapy or us at Motivate, they are extremely frustrated and hopeless very often because they don't understand their symptoms and they're not finding anybody else that is helping them understand their symptoms. And that is what we do. Your signals over time become symptoms. Your body is always talking to you. So we help you understand that so that you can therefore create change and eventually even think like us. So there are no limitations as far as you are not too old or too overweight. not flexible or coordinated enough, you can create change today. You just need a team of people to help you understand it. And that is how we see ourselves as guides on this journey for you. We do ask that you come with an open and positive mindset, because that is everything. And as well, we ask for you to bring your list of medications and past medical history, because all of that is part of this. If you don't ask, then they won't tell. Many medical providers do not understand the pelvic interactions with the rest of the body and how the nerves and the organs and the muscles all interact and can completely debilitate our quality of life. So understand that benign prostate hypertrophy and other types of prostatitis type of issues absolutely affect your quality of life, but you can improve them by learning more about how your nerves and your muscles and your fluids interact. This may not seem like a big percentage, but a much higher percentage of men deal with low back pain. And many of us have heard of sciatica or deal with sciatica. And so understanding that the sciatic nerve, we know that it can affect pain in the back, buttocks area, and all the way down the leg. But that all of the nerves that branch off of the sciatic nerve at L4, L5, branch down below that, L5, S1, and all the sacral areas. And those nerves are what innervate your pelvic muscles and organs. So pain in your back or your hip or your groin can all affect control and function of pelvic health, which is bowel, bladder, and sexual function. So knowledge is absolutely power here. If you continue to learn to live with your pain, which is signals or symptoms that your body is telling you something's wrong, you can continue to live with it. It won't get better on its own. It can branch out, and then your back pain issues can become pelvic health issues. Awareness is key to creating lifelong lasting change. So in order to meet your goals, we hand tailor your session with a very individualized, detailed initial evaluation, but then we continue to assess and reassess with every session. We want to know what's working and what's not working, because it's your life that we're trying to improve. So you can expect results very quickly with our proven strategy, which includes the 4 pillars of our treatment approach. So first, we're going to look at your behaviors, which is extremely important. What habits are supporting you and what habits are no longer supporting you? So this includes the 4 biggies, which is water, fiber, sleep, and stress management habits. And then we want to know your tissue health. Muscles need blood flow to be happy and healthy. You need blood flow in and lymphatic flow out. So using manual therapy techniques, we can help improve your tissue health and then teach you how to maintain it on your own for lifelong success. Posture, how your chest is aligned over your pelvis when you move and function. That's a huge key that you can bring awareness to and change today. And then the last, but certainly not least, is looking at your core coordination. So it's not, again, just about strength. It is about coordinating length and strength. So flexibility and strength. That is what we look at in order to create an individualized plan for you. And therefore you see results. I believe that a thorough, detailed initial evaluation is what sets the tone for a successful completion of your plan of care or graduation with all of your goals being met, which is absolutely possible. So come prepared to answer a lot of questions and understand that things that you never thought may be connected, such as falls or surgeries or other medical history, as well as your medications, may very much play an integral part in your symptoms. So the more that we look at all of that, the more thorough we're going to be able to give you a solid treatment plan. So we're also then going to look at your posture and your range of motion of the spine and the hips. And then we really want to understand how not only the strength of your muscles, but also the coordination of your muscles are affecting your symptoms. So the best way for us to truly understand how your pelvic floor is working and coordinating is to do an internal rectal pelvic floor muscle assessment. So we can't tell how well you perform a pelvic floor muscle contraction, which women know is a Kegel. So I can't tell how well you Kegel by looking at you. So the best way is to feel those muscles, how they contract and relax, if there's a difference, right versus left. If you can feel whether you can squeeze, and most importantly, if you can let go. Because if you don't let go well the first time, your subsequent contractions might not be as strong or coordinated, which will affect your third cough or the fourth time you get up out of your chair by the end of the day. So again, a thorough evaluation of your muscles, which includes an internal rectal assessment, is truly the best way to get an individualized treatment plan for you, which will guarantee success. However, if the idea of an internal rectal assessment is off-putting and it will stop you from coming to therapy, we will never do anything that you're not comfortable with. So open and honest communication is key as well to creating change. So if there's one thing that you walk away truly understanding at Motivate is that everything is connected. Your pelvic floor is not an island. It is part of your deep core. So your diaphragm and your pelvic floor, as well as your low belly, your low back muscles, that's your deep core. And then everything around it can affect your pelvic floor and is affected by your pelvic floor. So understanding that coordination is more important than pure strength, that it's not often just do your Kegels. Often it's not doing Kegels at all. The only way for us to truly know is to do that thorough assessment and then create a plan for you. I think. So expecting to be heard and seeing results does not stop on day one or once you graduate from therapy. We want you to continue to feel supported and have the resources you need to maintain lifelong success. So whether you're coming to therapy in the clinic or you need to stay safe and stay at home, you can do virtual visits through your smartphone or laptop. We are also constantly providing you tips and tricks to maintain your progress, whether it is emailing our newsletter, looking at all of our content on Facebook, Instagram, and YouTube, and then also taking a look at my book, Your Self-Care Matrix, to allow you lifelong success so that no matter what life throws at you, you have the tools that you need. If you still want to learn more specific to your symptoms, feel free to give us a call and set up a free consult, whether it is in the clinic or we can do it virtually as well. You will talk one-on-one with a licensed therapist to help better understand how we specifically can help you change your life based on your symptoms and your goals today. Take action today. We are here for you. Email us or give us a call and get started today. Bravo, great job. Thank you so much for taking the time to learn how to help yourself today. Thank you for spending this time with me. We look forward to working with you.